Hi, I'm Meyer. I'm a practicing pulmonary medicine specialist and allergist in Sacramento, California for years. During this time, we've seen not only lung disease, but we have a lot of allergies, not only asthma, but also hay fever that affects the respiratory tract from the tip of your nose all the way to the bottom of your lungs. One of the treatments for allergies is the nasal inhaler, and that is to give the medicine directly to the mucosa. And most people that will observe, they give a quick puff, and then it hasn't gone more than about here. The trick is to get from here to the center of your head, where all the sinuses and the membranes are, and the connections to the sinuses and the connection to your eustachian tube in the middle ear. So it's very important to get it to all the way back. So to get it all the way back, you have to inhale, blow out through your mouth, inhale to the other nose, and keep blowing out through your mouth. And each time you suck in further, it goes a few centimeters further as you blow it out through your mouth, and then suck the medicine further and further back. And as you can see from this diagram, from the tip of your nose here, it's quite a ways here to the center of your head where all the sinuses hook up with the nasal membranes, and then there's also a tube to the middle ear. And that's why people that have a lot of sinus infections, allergic rhinitis, hay fever, they get frequently middle ear infections. And sometimes it's not a full-blown infection, but gets obstructed, and you have mucus behind there and fluid behind the eardrum. And that's where the balance organs are, and that's where the sound is transmitted through. So people with fluid in their middle ear have difficulty hearing at times, and they also have very significant congestion. And to relieve that congestion, you have to inhale mucus-absorbing astringents that open up the membranes, and that's what these are. There's many of these on the market, come in all various sizes and shapes. But the important thing is you blow your air out as before, and then suck it in, and then blow it out through your mouth. Okay, so I was pulling very hard, so it probably in 3-4 centimeters, but keep blowing out through your mouth. And keep on blowing it back, and you can see then after several breaths of blowing out through your mouth, the medicine's still hung up here, but then it keeps going further and further back to where the ostia, or the openings to the various sinuses around the nose are, and where the tube to the eustachian tube or the middle ear is. And that's very important in treating these, and that's why so many middle ear infections are difficult to treat, and patients complain about them. They have recurrent infections and never get fully treated. So I hope that's been helpful, and we'll be back with you soon.